My name is Charlene Burmeister. I have worked at CSUN House since 2010. I started as a support worker here and worked my way towards a case management position. I'm just on an on-call basis right now due to much of the other work that I do provincially. So I am just integrating myself into the role as the Provincial Peer Coordinator for the BC Centre for Disease Control. I work as a Provincial Peer Coordinator with the Compassion, Inclusion and Engagement Project through FNHA. I started the first drug user organization in the North, which is CSUN, which stands for the Coalition of Substance Users of the North. I sit on many committees, the Canadian Association for People Who Use Drugs as a board member, also the BC Yukon Drug War Survivors. I work with CAI and open funding projects. I wear many hats. I have lived in Quesnel for probably about 27 years now. So I was born and raised in the Vancouver area, Fraser particularly, and moved up here when my youngest child was ready for kindergarten, and we've been here ever since. CSUN House kind of came to me in an indirect way through a research project I was doing at the time around illicit substance use in a rural community with the University of BC. And so I just started here casual on call and just recognized how amazing the services were and how we embraced the client population on their terms, and it was like a client-centered approach. And it was just the staff and the community members and the clients and everything was just a really great place and a great space to be. Mm-hmm. And so just continued in that work and moved forward along that spectrum. Mm-hmm. So CSUN was a vision that I had a few years ago when I was doing my work and moving throughout the province, and recognized how absolutely amazing other drug user organizations were in the work that they were moving forward around harm reduction and supporting people in focus groups to hear from community members and taking that work forward. And so there was no drug user organization in the North, and my thought was this has to change. And so through diligence and hard work and a lot of resistance and a lot of allies and support along the way as well, much of what came through CSUN House and the connections that I made here as well. I just got a small pocket of funding. We started getting peers together in meetings, started doing education opportunities, building capacity, having opportunities to go to initiatives and other things to build our capacity around the work, and finally got to a point where we have some unsustainable funding to open our own location and offer harm reduction supplies and training and distribution, naloxone training and distribution, peer-on-peer support, point of care testing for STIs and that kind of stuff, and just want to expand that to general meetings to hear from community members about their challenges, successes, and barriers, and then bringing that work forward in the best way we can while we still struggle and strive to build our own capacity as we work through that. I think it's really important that we recognize that Quesnel does not have all of the services that are necessary to support our most vulnerable populations of people with mental health and addiction issues. And so the health authority offers some services. I don't think they're robust enough to meet the needs. Certainly, we recognize that there is not enough wraparound services for people and that we need to have other organizations stepping up to do that work as well. And I just really like to see us working towards a collaborated effort as a community and how we can support people with these challenges in a client-centered approach, so that we're not forcing people to be abstinent or remain abstinent, but meeting people where they're at and allowing them to, for lack of a better term, drive their own bus in what healthcare provision looks like for them at that time in their life. I want to add that it's really disheartening for me when I see people of power and privilege in leadership roles spreading rhetoric that is really can be false at times and misleading, and that unfortunately lends to some really difficult conversations in community and trying to support the work while that rhetoric just has people thinking really negatively, and people are ill-informed and uninformed and have opinions about the work with not really understanding what the process needs to look like for people and how, oats and oats themselves and providing people with the medications that they need, whether that is an actual, what people consider a drug or a substance at this point, is something that is just really foreign. And I just hope that we can do some really great knowledge exchange opportunities to have people better understand what this work really looks like and how to best support people to wellness for themselves. So I think successes for us has been a part of my role with CIE as a provincial peer coordinator, where I worked really hard to get that initiative, even though I worked with them, get them into our community and start open dialogue. We have Mel McDonald and some really amazing community members that have been allies for people who use drugs and people who struggle with mental health issues. And so recognizing an ally and knowing that I needed support in the work that I intended to do has really lent to just people with lived experience having opportunities to engage with people who just really give us space to be who we are. And so the Clean Team initiative kind of came out of that as well. Seasons House has been an integral part to the support around that initiative, and really directly and indirectly around CSUN itself, and empowering people with lived experience to take that work forward on our own. And defining what that looks like for us, but supporting us no matter what we decided that definition would be. And so those have been ongoing and continued successes that I think will expand as we move into the future as well. Workload is something that we always have to consider, but I think there's so many amazing people who really understand the value of the work and will continue to move forward and create opportunities for people with lived experience to continue that. Seasons House supported by hosting and holding funding for us when we were not at a place where we could do that on our own. So that was really an integral part for us to be able to have a place to house the money and have accountability to the funding bodies and that. And we've just continued to move that work forward. And certainly in the proposals we always work together on that, and identifying that the capacity building is a big component for people in the north, especially because we haven't been integrated into many of those systems that have been going on for 20 years or better in, like the Vancouver area, like, some people refer to it as vansplaining. And people say things to me like, what are some innovative approaches to harm reduction and to the overdose crisis? And for me, it's like innovation in the north is access to harm reduction. It's that simple for us. That is an innovative approach due to some of the challenges that we have going on presently in the northern region, and the lack of really being connected to those systems in that same way for some time. I think it's really important for us to recognize that it's really hard for people who struggle with mental health and substance use issues when there's a lack of security to housing and food security, and those basic needs make it really hard for people to navigate any other systems that we are hoping to incorporate into a healthcare plan for them. And so when we as a community talk about not supporting people in housing, and that people have places to go and they should just get jobs, and all of those things that really feed into that negative conversation about not really understanding people's basic needs, and how if we don't stabilize people, we can't move towards that path of hope. And we have a lack of, and I don't think we're any different than any other community. There's a lack of affordable housing. There's a lack of food security. Certainly thinking about people who are on disability and income assistance, that there's a below poverty level and what that looks like for people. And I think as a community, we just really need to start to work together to empower the systems that we have, and bring a place for this conversation to enable people to have access to the services that are like part of just basic life, skills and life, moving forward. The conversations that we seem to see in the community with a lack of readiness around this, I think a lot of it really is about lack of education. And I think many times in the conversations that I'm able to have with people, and just having some analogies that people can identify with, like the fact that we have safe consumption sites on almost every corner for alcohol, and that alcohol is one of the number one problematic substances in community across our nation, and how people quite often aren't able to correlate how substance use is criminalized. And we also come from a place of history of prohibition where alcohol was criminalized as well. And we saw the same effects. People became very sick, people died, the bodies piled up. They recognized rather quickly that it didn't make sense and it wasn't working well, and that people were at risk. And so they moved towards legalization and a safe supply. And so people are able to, who choose to consume alcohol, are able to go to a relatively safe location to get a substance that is regulated and that they know what's in it. And that some people whose substance of choice is not alcohol do not have those same rights and privileges as Canadians. And all Canadians should have the right to decide what they choose to put in their body and have access to safe supply in whatever it is we choose. When I say those things, I see people in the room go, oh my God. And, we often, when we employ peers or people with lived or living experience, quite often the conversation is, well, if we give them money, they're just going to use it for drugs. And that may be the case. And that is not for us to decide. And we don't give you a Safeway card because you may not be allowed in Safeway. Or if you take it to your dealer, it's got half its value. But we don't go check your blue box at the end of the week to see how many bottles of whatever are in there. Why are you trying to make us accountable for what we choose to use our money for? And that's a big conversation I always butt heads with when we do initiatives and engagements with people with lived experience. Mm-hmm. It's really kind of two-sided and just, yeah. But the conversations get people thinking, and they're like, and I quite often say to people, why? Just simply ask people, why do you feel that way? And people have to go back and say, well, because my uncle told me that, or because that's what my family said all the time. And then it's a challenge to rethink your values and ideals and how the stigmatizing things that we do to each other is actually taught behavior. And we can unlearn that. And we can learn to support people in a much better way.
Are drugs bad?
Drugs are not bad, and drugs, for many people I know, actually will claim that drugs have saved their lives. If the trauma and the built-up stuff that's going on for people, sometimes people think about suicide, and sometimes drugs prevent that.